beyond the scope of the EMT. We call the Brunswick Electric and Brunswick County, mark off a danger zone. Lightning, repeat strikes can occur, either direct hit or ground current. So they can hit you directly or hit the ground, and you're exposed right there as well. Fire has includes smoke, oxygen deficiency, high temperatures, toxic gas, and building. Once again, I'm going to rely on my firemen. Use proper protection as well. Vehicle crashes, common events for EMS providers. Traffic, you may stop to help a vehicle crash, but there's still traffic going back and forth and around you. You need to be aware of your surroundings. Make sure you're wearing your vest. Make sure that you have assistants there, like your officers who can direct traffic, and the fire department can have someone directing as well. Down power lines, sharp objects. The vehicle has glass everywhere. You need to be aware of what's going on around you. Protective clothing, critical to personnel safety. Become familiar with the various types, cold weather, and then there's turnout gear. Turnout gear is for heat, fire, and like flashovers. Cold weather would be like wear an extra shirt, t-shirt, a sweater, a jacket, and then this cold weather turnout gear coat. So be prepared. You don't want to get too thick because you won't be able to move. All right, so protective clothing, preventing injury. Wear your gloves. Heat, cold, and cuts may reduce dexterity. If your fingers are cold, you may not be able to write. Helmets help protect your head from falling objects. Steel-toed boots are preferred in EMS, but agencies may be different, so you have to check with the agency you want to ride with before you go buy boots. And the clinical with us, we will adhere to the New Hanover County EMS. Eye protection, ear protection, skin protection, body armor. Okay, some EMS agencies are going to vest. They feel safer if they have a vest on. Remember, your truck has narcotics. When people are hooked on pain medications, sometimes, and thank goodness this never happened to us, but it may be, hey, they know what's on your truck and you're going to be in their area, so they're going to jump on board your truck while you take care of that patient, and you come back and they've been in your drug box, or, they got it open, or they hold you hostage to get it open. These are just scenarios of things. Skin protection, you need sunblock, not sunscreen. Sunscreen can screen it, but you're still going to get the sun. Sunblock blocks it from you burning. Ear protections help you with loud noises so you don't use your hearing. And then eye protection is to keep your eyes safe so you can see. Responses of the critical patient include anxiety. Hang on one second. Okay, here we go. I skipped one. Caring for the critical and injured patients. Let the patient know who you are and what you're doing. Introduce yourself. Do not walk up to a patient and touch them without their permission. That is one of my pet peeves. I always introduce myself. I always ask my patient, can I help you? And then I ask them what's going on. And when they tell me, hey, my head hurts right here. I smashed it on the dashboard. She was in an accident, or he was in an accident. And I asked them, they were conscious and alert. And of course, if they're unconscious, you're going to assume that they would want that care. Let the patient know you're attending to his or her needs. Sometimes in a bad accident, the patient will say, where's my mom? Where's my dad? Where's my brother, sister, or baby, or whatever? You have to reassure them that they're being taken care of while you take care of them. Responses of the critical patient include anxiety, pain and fear, anger and hostility, depression, dependence, guilt, mental health, and receiving related bad news. These are all responses that the patient will have. But then you've got the family as well that may have some of these feelings. So you've got to go in there and be the strong one and be the positive one and be there to say, hey, I'm going to help you the best of I can. We're going to get to the hospital. Is there anything you need to let me know? I need to know pertinent to your health. Do you have heart trouble? These are things you need to ask your patient. Communicating with a critical patient, very sad and grim. Orient the patient, be honest, deal with the possible initial refusal of care, allow for hope, and locate and notify members. Okay? I have a mentally retarded brother. He can communicate, but my brother is the one in charge of him. So you must also talk to him, unless it's a medical emergency. If he is in a life-threatening situation, paramedics can obviously help him. But if not, you have to get his guardian. Injured and critically ill children, ask for a responsible adult to accompany the child. Death of a child is a tragic event. Help the family in any way you can. Be honest. Let the family's actions be your guide on how you answer their questions, and prepare the parents. So that wreck that we had those two girls in, one of them died and the other one lived, and the mother had pulled out from church in front of oncoming traffic, and it was a really, really bad scene. My partner quit EMS that day. It was really, really tough for all of us. I wanted to make sure I did not. Yeah, there we go. I made sure all right. Death occurs quite suddenly or after a prolonged terminal illness. The EMT will face death. You may get called there and the patient had just died, or hospice is involved and you got called because hospice called you. There was no DNR. So you get there, you check a pulse, and the patient's gone. If there's no DNR, you have to family. Do you want us to start CPR? And you start CPR. That's a gray area when you have a terminal patient, but there's no DNR in place. Family can let you know not to start. Stages of grieving is denial, anger, bargaining, depression, and acceptance. Denial, anger, and hostility. Anger or hostility. These, I used to memorize the stages of grieving by DAB, the DA. Denial, anger, bargaining, depression, and acceptance. So I would DAB my DA for the stages of grieving. That's how I could remember it. You're going to have to come up with your mnemonic to be able to, of course, get this, down pat where you can memorize it. And this is this is really tough. There are some grieving classes that you can take. Hospice offers some. They're free. So when you get a little, when you want to take some extra classes to help you with this on calls. It's a good class. The EMT's role in the death and dying is to ask how you can help, reinforce reality, be honest, and allow the patient and the family to grieve. You can say to them, I can only imagine what you're going through. Death and dying, responding to grief, what you say and what you don't say, like, I am sorry for your loss. It's okay to be angry. It must be hard to accept and painful for you. Tell me how you're feeling. If you want to cry, it's okay, cry. So don't say give it time, things will get better. No, that's terrible to say. You have to keep going on. That's terrible too. you can always have another child. You can never ever say that. That is the worst thing. I thought the top one was, but that one would be the worst if you lost a child. Are there any questions? I'd like to know if there's any questions on anything we've covered so far. Okay. EMS is high stressed. Important to know causes and how to deal with it. There is something called the general adaptation syndrome. Alarm response to stress. Your body can let you know if it's, having a response to stress, like you get a headache. That could be one. Physiological signs of stress: increased respiration and heart rate, increased blood pressure, cool and clammy, dilated pupils, tense muscles, increased blood glucose levels, perspiration, and decreased blood flow to the gastrointestinal tract. Dangerous situations: physical and psychological demands, critical, ill, and injured patients. There's one on here that is not, and I feel like multiple patients. Let's say you went to a house and there's 3 or 4 patients there. That could be very stressful at first. The dead and the dying. Overpowering sights and smells and sounds. Back in the early 80s, I transported a patient from Elizabeth City, North Carolina to the burn unit in Centera Hospital in Virginia. And I'll tell you, I can still smell the singe of his body where he got burnt. He was talking to me the whole way there. He had a good airway. And I can still remember his face, and I can remember the smell of his body. Okay, multiple patient situation. Angry and upset patients, family and bystanders. Unpredictability and demands of EMS. Just remember, officers can clear a scene and say it's safe to go in, but always keep looking around and making sure that that scene that is safe doesn't become unsafe. That has happened to some of my friends recently when they're on calls. The officers say it's okay to go in, everybody's cooperative, good scene, and then all of a sudden it becomes a hostile environment, or they're all getting mad and they're threatening guns and stuff. That's when you've got to take up and leave. You either take the patient with you, which is what you need to do, and get out of there, and also have your partner call for help. Non-critical, non-911 patients, they could be stable, and then you're transported to a nursing home, and he becomes or she becomes unstable. Maybe you're taking them to the doctor, and they become unstable. Remember, call for additional help if needed, and sometimes wait times at the hospital when you're sitting around trying to give the hospital your patient. Acute stress reactions occur during stressful situations. Delay stress reactions manifest after stressful events. Cumulative stress reactions prolong and excessive stress. Stress will play a major part on your body. All right, PTSD, everybody is pretty much aware of that. Post-traumatic stress disorder can develop. Critical incident stress management was developed to decrease the likelihood of PTSD. So critical incident stress management was what I was talking about. After a serious call, you want to make sure that your supervisor, talk to them and say, can we have a debriefing? And this is what he'll do. He'll call in the critical incident stress management person and debrief that scenario, and everybody can sit around and talk and let everybody in that room know how everybody feels. If your partner doesn't talk in there, maybe he doesn't feel comfortable in the crowd. He may feel better with just one-on-one. If there's a problem with the scene, that is something you need to go to your supervisor with immediately. All right, warning signs of stress: irritable towards coworkers, family, and friends, inability to concentrate, difficulty sleeping, increased sleeping and nightmares, feeling of sadness, anxiety or guilt, and indecisiveness. One minute they're doing this, the next minute they don't know what they're doing. They're stressed. Personal reactions to difficult situations are difficult. This is normal. EMT must deal with these feelings. Talk to a best friend, maybe your girlfriend or your boyfriend. Many situations are stressful for everyone. Use extreme care in your words and your actions. Bring a sense of order and stability to the situation. You will respond to domestic. You talk about a stressful situation? Yes. But you are the person that has to get everything under control. Hopefully, LEO is there helping you as well. Sometimes what they say make the situation stressful. So you have to come in and kind of calm everything down. A patient's reaction is influenced by many factors. Allow the patients to express their fears and concerns. Transport parents with their children. If the child I'm taking care of is not critical, I'll allow the parent in the back and I'll allow them to hold them and I'll put the seatbelt on. Like if the child is having an asthma attack, I don't want that child to be anxiety because I don't want their heart rate up because the breathing treatment is going to cause their heart rate to increase. So I want this child as calm as possible and helping them with their breathing. And so I'll let mom and dad hold the child, whichever one they want. And the other one can come by POV. Uncertain situations is unclear. It's a true medical emergency exists sometimes. Contact medical control. Contact your 911 center. Say, hey, look, we're here. We don't see anybody. They're going to come back and give you some more information. Our dispatchers are great. All right, violent situations created by civil disturbances, large gatherings, domestic disputes, and crime scenes. You arrive to a shooting, the police officers has cleared it, and all of a sudden you start hearing gunfire again. Get your patient, get in that truck, and get out of there. Know who is in command. Protect from dangers to provide care. Law enforcement secures the scene before you entry and use cover and concealment technique. Call for additional help and do not disturb the crime scene. If you suspect it is a crime scene, get off that crime scene. Call your police immediately. You want to do the least you can to disturb that setting. Emergencies that do not have a clear physical cause may turn out to be physical, or it could be a medical that caused that person to behave differently, such as hypoglycemic, head injuries, alcohol. You got drunk, you fell down, bumped your head, you have a subdural hematoma. So these are examples of behavior emergencies. Result in, irate behavior. Use caution, get additional help if you need it. Call law enforcement. Culture diversity. Each person is different and unique in their own way. You need to communicate respectfully. Use culture diversity as an asset. So if I have a Hispanic partner who, of course, speaks Spanish, they can help me on the scene where I can't speak it. Culture diversity on the job is an effective way to strengthen your public service workforce. Understand how to communicate effectively with your coworkers from various backgrounds. Sexual harassment, there are two types. Quid pro requests for sexual favors. Hostile work environment like jokes, touching, etc. Report harassment to your supervisor immediately and keep notes. Substance abuse increases the risk on the job, leads to poor decision making. Seek help. And most employers have employee assistant programs that can help you get the help you need to get off medications or drugs that you shouldn't be taking. And also alcohol. Suicide prevention, cumulative stress plus, being on drugs or any of that, or medication sometimes can cause a person to commit suicide. Just the stress alone, people need an out, and that to them is the easy way out. So remember, get help. Help your partner. Don't tell on them. Just say, hey man, get you some help. I'm here to help you. Suicide prevention is cumulative stress and acute. Intense stress can weigh heavily on EMS providers. If you or a colleague express suicidal indications, get help for them immediately. Get help for yourself if it's you. Elements of an injury or illness is prevention programs or management leadership, workers' participation, hazard identification and assessment, and hazard prevention and control, education and training, and program evaluation and improvement. And that is it for today. And if anyone needs any help or if you have questions, let me know.